the show Rachel Dolan with the National Academy for State Health Policy. Rachel, thank you for being here. And I'd like to start by asking you just to give us a bit of a national perspective. How are things going when it comes to the Affordable Care Act differently state by state? How do you see different states progressing or not in this new law?
Sure. Well, just some background. Remember that the Affordable Care Act gave states some choices related to their marketplace. States could either set up their own marketplace or have a federal marketplace.
And just to remind people, the market, when we say marketplace, at one time we said exchange, and now we're calling them the marketplace. This is where people can go, as we just talked about, and doesn't have to be on the website, but you go on and you can buy insurance through the marketplace, through different private companies.
Right, exactly.
And so I interrupted, so go ahead. So different states.
Yeah, so states could choose to set up their own marketplace, have a federal marketplace, and then there was also added the option to partner with the federal government on a marketplace. And so far, at State Reform, we track the project I work on, state decisions related to marketplaces, and 15 states and DC are running their own marketplace. 9 states are partnering with the federal government, and 26 states, including Missouri, have a federal marketplace.
So what are you seeing the difference there? How is it going for those who decided to set up their own state marketplace versus those who did not?
Well, I think especially in the initial weeks, we saw that the state-based marketplaces were much more successful at getting folks enrolled than healthcare.gov. Healthcare.gov took about 6 weeks to get its issues fixed. There are a couple of states that are still having some technical issues, but I think overall most state-based marketplaces have overcome any issues they had and are really seeing a large uptick in enrollments, especially in December.
Can you give us, sometimes we need a little outside perspective of ourselves. Can you talk about Missouri for a minute and kind of give us your perspective from DC on how things are going in Missouri? Anything that gives us, makes us unique right now?
Sure. Well, I mean, Missouri found itself in a situation over the past few years where there was a Democratic governor and a Republican legislature, and they were sort of at odds over the Affordable Care Act. The Democratic governor supported a state-based marketplace and the Medicaid expansion, but as you all just discussed, the Republican legislature is not really in favor of that. And while in state government, it's not really unusual for the governor and the legislature to be at odds, in your case, the legislature passed a bill that really prohibited the governor from setting up a marketplace using executive order. And that was a measure that a number of other states used, that their governors used when they couldn't get legislative support. So that kind of hamstrung Missouri and kept you all from having a state-based marketplace. And then the Medicaid expansion, really will also need legislative support moving forward.
From the national perspective, how detrimental to the success of the law is Medicaid expansion being an option for states?
Well, I think if you think of one of the goals of the Affordable Care Act is expanding coverage, which it really is, the Medicaid expansion being optional, certainly doesn't help that. The Medicaid expansion, obviously, as you mentioned earlier, wasn't designed to be optional. It was required. All states had to expand coverage to this new population. It was basically changing how Medicaid worked. Medicaid traditionally was a program that was aimed at certain categories of people, like parents of dependent children, the elderly, and the disabled. And the Affordable Care Act was just going to say anyone under a certain income level will be able to get health insurance coverage. But now with it being optional, as was mentioned earlier, a lot of people will honestly be too poor to get help, as odd as that sounds. They won't be able to qualify for tax credits, but when the state doesn't expand Medicaid, they won't be eligible for that help either.
We've heard a lot about changing deadlines and other fixes or compromises, depending on your perspective, things that have changed in the rollout of this law from the executive branch. Are you hearing any talk about taking on that issue of Medicaid expansion at the state level, or is this just going to work itself out state by state?
I think you're really going to see it work out state by state. I think we've seen a couple of states proposing sort of different ideas than what was originally proposed in the Affordable Care Act. Arkansas has gotten through a premium assistance model where they're going to use basically funding to buy folks that would have been in that expansion population private insurance coverage. And so I think you're seeing a couple of states moving to follow that model. So I think in the true sense of federalism, we're going to kind of see each state be a laboratory moving forward with the Medicaid expansion. And I think that's really how it will play out.
Tell us what else you're working on. What are you tracking with your organization? And maybe look into the future just a little bit for us. What will we be talking about next year?
Sure. Well, I don't want to make too many predictions, but it is always good to remind folks that the decisions states have made so far aren't set in stone. So states do have the option to change their marketplace model in the future. States that are federal marketplaces could move to a state-based marketplace in the future. States can also choose to opt into the Medicaid expansion in the future. And we've seen a couple of states so far submit proposals to expand Medicaid after 2014. I think another big thing to track next year will be the gubernatorial elections. There are 36 states that are having an election at the governor level, and that could really change some of those decisions that I talked about. For example, Virginia just had an election in which they had a party turnover, and already the new governor is potentially coming out in favor of the Medicaid expansion, whereas the previous administration wasn't in favor of it. So I think that's definitely something to keep an eye on.
Do you see anything from other than what you just talked about there with the election? Do you see any sort of groundswell, any sort of activism from folks who either do or do not want Medicaid to expand? Is this something that's taking hold in any kind of a passionate way with people?
Well, I think what will be interesting to see is in states where they're nearby or surrounded by states that have expanded Medicaid and maybe have a state-based exchange, seeing the differences. Why does my neighbor in the state next door have health insurance and I'm not eligible? So I think maybe once people start to see how people that are pretty similar to them and are nearby them have different options than they do, then you might start to see people, asking their legislature or their governor, why is this the case? Why aren't these options available to me?